Hello everyone, and welcome to another episode of Tiny Matters with Dr. K. I am Dr. Kutso Sivatsiba. Back to school season is meant to feel hopeful. Clean uniform, fresh starts, and new routines. But for many parents, it quietly brings something else. Exhaustion, guilt, and the persistent feeling that you're already left behind. Today, we're talking about something a little different. We're talking about the load that parents carry, the emotional and relational weight that doesn't always show on the outside. I'm joined by Lerato Rasoaisi, a clinical psychologist who helps families navigate burnout, parental overwhelm, and guilt. Thank you so much for joining us, Lerato.
Thank you for having me.
So tell us a little bit about yourself, the work that you do, and why you do it.
So I'm a clinical psychologist, born and bred in the Vaal, and now I reside in Johannesburg. I've got two practices. One is here in Soweto at Dr. Mazeke Hospital, and another one is in Morningside in the northern suburbs. I really am passionate about mental health. I love engaging with people. I love understanding behavior. That's what got me into psychology. Why do we do the things we do? There's always like a why, right? Yeah. So that fascinates me. And I work with adults in my both my practices. So most of the time I see neurotic patients, which means dealing with stress, like just normal things, not like acute psychosis or anything like that. So adults that are dealing with stress, anxiety, depression, burnout, just normal life adjustments, sometimes divorce, loss, such things.
Okay, so the everyday emotional difficulties of existing, basically.
Yes.
Okay. All right. So from your work with adults, what would you say are the challenges that come with the typical start of a school year?
So I think anything that's new, especially for the kiddies that are starting either grade 1 or intermediate. So I think with anything that's new, right, it's challenging. Yeah. It's scary. The unknown is scary. So for those little ones that are starting grade 1 or for those who are taking like their 3-year-old to creche for the first time or, going to grade the intermediate level, grade 8, anything that, even varsity first year. Yeah. That's really hard for parents as well and the kids. So both parent and child are dealing with separation anxiety firstly. Mostly the parents more than the kids, Yes, kids are scared, but I think for them, they're excited as well. And then the parents are kind of sitting more with, is my child going to cope actually? When they don't really have that anxiety because of that maybe lack of deeper understanding of what's going to happen. Yeah. So I think the anxiety, the separation anxiety, and then just the anxiety of, is my child going to cope, socially? Maybe some kids are a little bit more withdrawn, and if your child will maybe struggle with making friends or stuff like that more, or that's your anxiety versus kind of the reality. And then some parents are perhaps worried about academics, like will my child actually, maybe for instance, the varsity child, are they going to cope, right? And some parents actually are dealing with the reality of my child is autistic, they have ADHD, they have other developmental issues. So it's not just an anxiety, but it's a real fear of will they actually cope? Yeah. So I think there's mostly all of that anxiety-based stuff.
Yeah. And I imagine because you speak a lot around worry over the child, right? Worry about what's going to happen with their child, right? But I also think parents in their own lives are going through so much, you know, so there's also that. There's also the fact that you're navigating this worry, this child that's going to university, or this child that's going to high school, or this child that was bullied last year in a different school and has now changed schools with everything else that you're going, and I think it's a recipe. It's a perfect recipe for disaster because you're trying to navigate all of these things. I think that with all this kind of like pressure to get everything right, like I say, parental burnout is a real thing. I think parental guilt is a real thing. Oh, yeah. I mean, the WhatsApp groups and everything is just enough to make you feel like you're getting it all wrong, What does burnout look like in a parent? What does it look like? How does it present?
Yeah. Essentially overwhelm, think about, I always say to my patients, think about juggling balls like at the circus. Who juggles balls? Yeah, the circus. The circus
The
guy.
clown.
The clown. And I always say, think about those balls kind of adding, from one child to two child. You're juggling work, you're juggling, church responsibilities. And now it's the beginning of the school year. So you're juggling getting things ready and versus if it's mid-year, right? So juggling, and then I keep adding balls. You've got 3 balls, then you've got 4 balls, then you've got 5. At some point, it's just too much. You're getting overwhelmed.
Yeah.
And that creates a lot of stuff. Like, you're just exhausted a lot of the time. You're forgetful. Maybe irritated, edgy, everything kind of sets you off. The plate drops, your child drops the plate and already you're just like, who's in the kitchen? What are you doing? On edge. Sometimes teary, moms could be teary, but dads could present with a little bit more irritation and kind of anger outbursts, or avoiding home. Either or, mom or dad. It doesn't even have to be dad. Mom could be, working more than usual, or at the mall and like shopping and like getting things ready. So there's that type of stuff.
So it's not just being tired.
No.
There's a big psychological aspect to it as well. Because we all feel tired, right? Anyone who's a parent feels tired perpetually, all the
time.
All the time. What are there more subtle signs that a parent is more moving more into burnout? The point where we can still kind of do something? So even though you're functional, but actually you're burnt out. Yeah.
Yes, definitely. So when, even when you're functional, you're able to wake up and go to work, perhaps you are, like I said, more forgetful than usual. So it's okay to forget, where did I put my car keys?
Yeah.
But then there's holding your car keys and still looking for them for 5 minutes.
Yeah.
That's a little bit on the, kind of your brain, your cognitive processes are overwhelmed, right? So there's that, there's the depressive symptoms creeping in rather.
Yeah.
And so, that might look like isolating yourself more, not really enjoying things you enjoy, like cooking for the kids or taking them out for a walk, not really enjoying being with the kids, right? And avoiding them more. And your anxiety levels, like I said, and stress levels just being a little bit heightened, right? So those might be a bit more subtle. Concentrating at work, could be. So your functional cognitive functions also at work might then start dropping, right? So that those could be a little bit more subtle.
Yeah, I think just as you were talking, I was just thinking about the fact that we are mostly in this hyper functioning, just need to get through the day, need to get through the chores, need to get through my child getting through school. And I imagine that comes with a lot of guilt for parents, because you are exhausted and you are actually still able to function because this needs to be done, So, the one thing I see, and obviously I see children, right? And I see their parents, and their parents will obviously bring them in for all sorts of different things. Sometimes it's a routine check, but the one kind of persistent feeling I see and experience with parents is this feeling of guilt, this feeling of like, I'm just not doing enough, even, the really good parents, the ones that walk out and I'm like, wow, they are such good parents. Yeah. There's this persistent feeling of guilt. And I think a lot of parents kind of carry it through their parenting. Yeah. Why do you think that guilt is this kind of recurrent, persistent feeling amongst parents?
I think it's also important to start with, there's normal guilt, and then there's obviously kind of overwhelming sense of persistently overwhelming guilt.
Yeah.
Look, I think it's important to identify that there's normal guilt, and then there's, kind of not normal and too much guilt as a parent or anyone who has any type of responsibility. And so as a parent, you're given this beautiful, precious person that you're meant to care for and make sure that they're safe and all of that. So of course, if something happens that is a little bit off, you will feel guilty, right? Especially when there's a lot of expectation around parenting to keep them, make sure they've got this, make sure they've got that, they're doing that, they're developing, according to their milestones. Yeah. So feeling guilty, it's like almost having an invisible accountability partner. So someone kind of nudging you saying, hey, you know, what happened there this term, you know, could we have done better? Or, you know, I used to do work for the Smile Foundation, and when I go to the burns units, I used to do group therapy with the parents, or supportive therapy. And a lot of them, you can imagine your child is burnt, you know, overwhelmed with guilt. And I would start by saying, instead of saying, no, don't feel guilty, it wasn't your fault, I'll start by saying, yeah, I get the guilt. I get the feeling of guilt. This is your child. You have a responsibility to protect this child. Yeah. The guilt, if it wasn't there, I would be a little bit worried. Yeah. So you have this guilt because you have this person to take care of. But then if we shift to the guilt that's not normal, that's kind of like, you know, a bit pathological or a bit like too much, I think that guilt has a lot to do with the, I guess, unreasonable expectations or standards, especially in this day and world where, in this day and age where we are living with such like prominent like social media and all of that. Yeah. And just the standard of like parenting is so much.
Absolutely higher, right?
Very much. Yeah. Right? Yeah. So it's really like just, you know, it's my mom and like my mom-in-law always say, you know, at your age, when they had kids our age, they didn't do like birthdays every year. And we do like parties every year. And for them, it was normal not to. So you can imagine this year, you have the birthday party to, you know, for 3-4 people to deal with and to plan, then you still have work. And so it's overwhelming, right? And you look at your social media and there's whoever doing
it perfectly. And color-coded charts and the things on the fridge and everything else.
Gosh, right? Yeah. And then you just feel like, I'm not doing enough. Yeah. I'm not enough, right? Or you're a first-time parent, and you know, and so again, you see all of the stuff on social media, and so you already go into this journey thinking, I need to have a photo shoot, I need to do this, I need to, you know, and they first start, and I need to take, you know, that every month, like 1 month picture, 2 month picture.
I mean, it's cute, but sure.
Where do you get the time as a postpartum mommy to do that? Yeah. So I think it's important to know which is normal and which is when it's starting to get too much. Yeah. When it's persistent and you cannot think of anything but I'm a bad mom. And when it's actually there, it's no longer even guilt, it's shame. It's the difference between shame is guilt is I've done this thing outside of me that's not good. But shame is I am the thing that's not good. So if you feel I am a bad mom, it means you can't change anything about your parenting that you can say, objectively, maybe let's start doing this differently, right? So yeah, definitely the shame, the guilt, both guilt, but the shame and guilt issue with parenting is a lot. And you know what? Let me tell you something. Every parent without fail feels it. Even though when you look at another parent, you think, they're doing fine. They probably don't feel guilty. Yeah. I mean, you know, because you see them, every one of them, even the ones who are doing a great job, you know. So yeah, it's a very important one. Yeah.
I always think of guilt being kind of at the intersection of love and fear, particularly parental guilt. You know, it's I want the best because I love you so deeply and I know that I need to take care of you, but I'm just so scared that what I'm doing is just enough, right? And it makes me think of just enough, you know, and the principle of just being enough, right? And I find that quite like comforting, at least for myself, you know, where you think, okay, what is just enough in this situation? You know what I mean? Do you want to say anything about that?
Oh yeah. There's this theory in psychology. I just forget who came up with it, but there's a theorist who said, I think it might have been Melanie Klein, who said 40% of parenting, if you can do 40%, that's enough. I know.
Not a very high standard to aim for. But
I know, even us in class, we were like, what? 40? You're not, that's just a pass. You're not really, well, that was a pass then, but 40%, yeah. That is enough. I mean, think about, you've got this human and most parents have 3 of them, you know, 2, 3, 4. It's a lot. You can't, with your first child, you most probably can do all these things nicely on an 80% level. Come second child, what happens? It goes down a little bit because your capacity is going down. Third child, what happens, right? But then it doesn't mean that the mom who's got 3 children is loving these 3 children any less. It just means they cannot do this like thing where they give you everything at once, all the attention, all the clothes, all the money, right? But they're still loving you. So I want to, that's why I was so excited when you said it, because I want to leave a lot of parents thinking about 40 when you've done even the bare minimum, what you feel is the bare minimum, often that's actually enough. Kids, I always say to parents, especially in the medical consults, when I go see kids who have been burnt or whatever, I say, look, there's nothing you need to say to this child or do more for this child. The fact that you are here on this bedside is enough. Showing up every day just to be here. Your presence, and I'm sure as a pediatrician, you know that their presence physically is actually helping their healing.
Yeah.
So that's enough. Good enough is enough.
I mean, when I think 40%, I'm just like, oh my gosh, which children are going to thrive on 40%?
On 40%.
Right. Okay, but here we are. I plan going forward, I'm going to do 40%. Well, at least I'm going to try to do at least 40%.
But remember also that a child, I mean, especially in a lot of collectivistic communities, a child is not raised alone. They're raised by a village.
Yeah.
If you're doing 40%, your partner's doing 40%, your mom is doing 40% for you, your dad is picking up the kids after soccer, your other mommy friend is saying, friend, you're working late, I'll pick them up, hey? What is that giving them?
Yeah.
A full overflowing cup.
True, but I want to disagree a little bit with you on that.
Okay.
Because I think that modern society is such that, yes, we say it takes a village, but the village looks quite different to what it looked like, back then.
Yeah.
So there are a lot of situations where there's single parenting in the mix. A lot of situations where grandparents are staying far away, and I think what that's done is probably increase the guilt aspect, because where 40% may have been enough, before, because there was everyone else filling in the gaps. A lot of parents are kind of doing a lot more solo parenting, a lot more parenting in the midst of grief, a lot more divorce, like you're saying, so I think that that's probably added a new dimension to the guilt around parenting, you know what I mean? I just see it as though I don't know how much you can show up if you're feeling bad, if you're feeling shame, like you mentioned. I don't know. But how does that affect our ability to show up with our kids,
The guilt.
The shame.
The shame and the guilt. Yeah. Look, also, I feel like I need to quickly go back to this. I mean, the 40% doesn't mean you can't do 80. It doesn't mean you can't
on a good day
rise to the occasion. Not even on a good day. If you're able to do the 60, that's great. But realistically, if you're a parent, you know that 60 over 5 days or even over a year is really, it's a bit too much.
Yeah.
I just wanted to push that in quickly. But in terms of how the guilt and the shame shows up, if you're feeling guilty and shameful all the time, you're already showing up kind of like on a back foot. You're not really trusting yourself. You're anxious. So it looks like an anxious parent. It looks like a parent who is maybe even like, overbearing, because everything needs to be perfect, and they kind of like always doing things for their children, and that's not really helping the child develop and become autonomous. They're just hovering all the time, and they're creating anxiety for this child. So this child is also learning, or kind of but they're learning to be anxious in their baseline. So that kind of anxiety, that kind of irritation, mom is, that mom that steps in and all the kids are like, let's be straight, what needs to be done. Yeah. And that's not kind of like the feeling that any child should have when their mom comes in or their parent comes in. They should be like excited, you're back. I want to tell you about this and this, you know. And so I think parents who sit with that then show up like that with their kids.
I think that's difficult.
Yeah, it is.
I also think that there's a lot of kind of social media, there's a lot of WhatsApp groups, there's a lot of things, kind of constant reminders that, as a parent, you're not quite doing enough.
Exactly.
How come you don't know that exact schedule and that, So I think there's a lot of that. So I think it does make it quite difficult to
definitely
to own it.
Definitely. I want to add that, with what you were saying about being a parent that doesn't really have a lot of support. I don't know if, I don't know what you think about this as well, but having help, like hiring help, right? Yeah. Versus having your mom or your sister being there. Some parents feel shameful about that. Oh, I had a helper raise my children instead of me doing it myself. So you've got moms who wake up early to cook dinner and get their kids ready, and then go to work, come back, warm up dinner, give their kids, do homework, whatever, and then do it every day again, I mean, is that really a sustainable plan where you could actually have, a helper to come in and help you bridge the gap? And then, my cousin said to me one day, well, I was, I think my daughter was still very young and I was working a lot then. And he said, and I was telling him about the guilt, and he was like, would you rather have a lot of poor, I guess, quantity with your child in terms of time, or would you rather have quality time when you have with her?
Yes.
Would you rather be able to, when you get home, sit down and you're not stressed, but like play with her for an hour? Or would you rather be just, there all the time, but you're not really present?
Yeah. I absolutely agree with that. I'm the advocate.
You're the advocate of that?
Because I have an au pair for my kids, right? And I remember when I hired her, I actually said to her, I want the time that I spend with my kids to be quality time where we are actually spending time together, not me shouting at you because you cannot get this concept, or really upset because what did I tell you about writing on the line and coloring in one direction, and I think absolutely there's a role for parents in every aspect of your child's life, absolutely, sports, academics, their emotional development as well, 100%. But for me, I absolutely think that we need to be able, or if you can, choose the parts that you truly want to show up for and show up well and 100%. Do that part well. Because I find so many parents start resenting their kids almost, or resenting certain times in the day. And that will definitely show up in your child. I mean, that will definitely, if they know that, Matt's homework is coming, the belt is ready. If they know that is happening, if they know that is happening, I mean, what are they going to learn in that time? And are they? And I see so many people, and I speak to so many people that carry these like almost micro resentments of their parents for the things they did when they were young. And now that we are parents and we are able to kind of think about it, we're like, well, I can imagine how he probably came home from work, probably had a terrible day at work, and then this happens. Plus, you got the maths homework wrong that he's trying to teach you. I imagine that. For the parents, we were all just doing our best. But for the child, it shows up as this angry, like you say, aggressive, extremely irritable parent who really is, at the end of it, just trying their best.
And is just overwhelmed.